Hello, nursing students. Welcome to Nursing Exam Preparation, your ultimate resource for mastering nursing exams with confidence. In today's video, we'll take you through 150 multiple-choice questions, MCQs, on drugs and side effects, each carefully crafted to challenge your knowledge and deepen your understanding of this critical topic. Following each question, we'll provide detailed explanations, helping you not only choose the right answer, but also grasp the reasoning behind it. Whether you're just starting out or reviewing for your exams, this video is filled with valuable content to test your skills, enhance your critical thinking, and reinforce key concepts in pharmacology. Be sure to like, share, and subscribe to Nursing Exam Preparation for more helpful resources. Don't forget to hit the bell icon to stay updated with our latest videos, all designed to help you succeed. Once you've completed the video, let us know your score in the comments below. We'd love to hear how you did. Let's dive in and master drugs, side effects, and pharmacological knowledge to achieve your exam success. 1. A patient is prescribed an ACE inhibitor for hypertension. Which side effect is most commonly associated with ACE inhibitors? A. Hyperkalemia. B. Hypoglycemia. C. Dry cough. D. Weight gain. Answer: C. Dry cough. Rationale: ACE inhibitors often cause a dry, persistent cough due to the accumulation of bradykinin. Hyperkalemia, A, is a common side effect but less frequent than cough. Hypoglycemia, B, is not associated with ACE inhibitors but with insulin or other diabetes medications. Weight gain, D, is not commonly associated with ACE inhibitors. 2. A patient on warfarin therapy is instructed to avoid foods high in vitamin K. What is the rationale for this recommendation? A. Vitamin K decreases warfarin metabolism. B. Vitamin K inhibits the effects of warfarin. C. Vitamin K increases warfarin toxicity. D. Vitamin K accelerates warfarin clearance. Answer: B. Vitamin K inhibits the effects of warfarin. Rationale: Vitamin K plays a critical role in clotting, and its intake can reduce the anticoagulant effect of warfarin. Increasing warfarin metabolism, A, or clearance, D, is not the mechanism. While warfarin can be toxic at high levels, vitamin K counteracts its therapeutic effects, not increases toxicity, C. 3. A 70-year-old female is prescribed lorazepam for anxiety. What is the primary concern when administering this drug to older adults? A. Respiratory depression. B. Increased risk of falls. C. Excessive sedation. D. Increased liver toxicity. Answer: B. Increased risk of falls. Rationale: in older adults, lorazepam can cause significant sedation and impair coordination, leading to an increased risk of falls, B. While respiratory depression, A, and sedation, C, can be concerns, they are more likely in individuals with existing respiratory conditions or in combination with other sedatives. Increased liver toxicity, D, is not the primary concern with lorazepam. 4. What is the most common side effect of opioids like morphine? A. Constipation. B. Hyperglycemia. C. Diarrhea. D. Insomnia. Answer: A. Constipation. Rationale: opioids, including morphine, frequently cause constipation due to their effect on gut motility, A. Hyperglycemia, B. Diarrhea, C. And insomnia, D. are not common side effects of opioids. 5. Which of the following drugs is most likely to cause an allergic reaction that includes rash, fever, and eosinophilia? A. Acetaminophen. B. Penicillin. C. Aspirin. D. Ibuprofen. Answer: B. Penicillin. Rationale: penicillin is a common cause of drug-induced allergic reactions such as rash, fever, and eosinophilia, B. Acetaminophen, A, aspirin, C, and ibuprofen, D, can cause adverse effects, but these are not typically associated with eosinophilia or an allergic reaction with the same clinical presentation. 6. A nurse is administering amiodarone to a patient with arrhythmias. What is an important side effect to monitor for during treatment? A. Liver toxicity. B. Hair loss. C. Visual disturbances. D. Hyperglycemia. Answer: C. Visual disturbances. Rationale: Amiodarone can cause visual disturbances, including blurred vision and halos around lights. C. Liver toxicity. A. Is possible but less common, and hair loss. B. And hyperglycemia. D. Are not primary concerns with amiodarone. 7. Which of the following is a potential side effect of statins, e.g., atorvastatin, that requires close monitoring? A. Hypoglycemia. B. Muscle pain or weakness. C. Increased appetite. D. Insomnia. Answer: B. Muscle pain or weakness. Rationale: statins can cause muscle pain or weakness. B. Due to rhabdomyolysis, a rare but serious side effect. Hypoglycemia. A. Is not typically a side effect of statins. Increased appetite. C. And insomnia. D. Are not associated with statin therapy. 8. A patient taking digoxin for heart failure begins to show signs of nausea, vomiting, and confusion. What is the most likely cause of these symptoms? A. Digoxin toxicity. B. Hyperkalemia. C. Hypertension. D. Allergic reaction. Answer: A. Digoxin toxicity. Rationale: nausea, vomiting, and confusion are common signs of digoxin toxicity. A. Especially when serum levels are elevated. Hyperkalemia. B. Can occur in digoxin toxicity, but the symptoms are more characteristic of the toxicity itself. Hypertension. C. And allergic reactions. D. Are not typically linked with digoxin overdose. 9. A patient is taking a thiazide diuretic for hypertension. Which electrolyte imbalance is most commonly associated with thiazide diuretics? A. Hypokalemia. B. Hypercalcemia. C. Hyperkalemia. D. Hyponatremia. Answer: A. Hypokalemia. Rationale: thiazide diuretics can lead to hypokalemia. A. By increasing the excretion of potassium in the urine. Hypercalcemia. B. Is rare with thiazides, and hyperkalemia. C. Is more likely with potassium-sparing diuretics. Hyponatremia. D. Can occur, but it is less common with thiazides than hypokalemia. 10. A nurse is administering lorazepam to a patient with anxiety. Which side effect is the nurse most likely to monitor for in this patient? A. Sedation. B. Hypertension. C. Hyperglycemia. D. Constipation. Answer: A. Sedation. Rationale: sedation. A. Is a common side effect of lorazepam and other benzodiazepines. Hypertension. B. Hyperglycemia. C. And constipation. D. Are not typically associated with lorazepam use. 11. A patient is prescribed a proton pump inhibitor, PPI, for gastroesophageal reflux disease, GERD. Which of the following is a common side effect of PPIs? A. Headache. B. Diarrhea. C. Insomnia. D. Constipation. Answer: A. Headache. Rationale: headache. A. Is a common side effect of PPIs. Diarrhea. B. Is not typical for PPIs, and insomnia. C. And constipation. D. Are not commonly associated with this drug class. 12. A patient taking hydrocodone for pain reports drowsiness and confusion. What is the most likely cause of these symptoms? A. Drug interaction. B. Sedative effect of hydrocodone. C. Anxiety from pain. D. Dehydration. Answer: B. Sedative effect of hydrocodone. Rationale: hydrocodone, an opioid, has a sedative effect. B. That can cause drowsiness and confusion. Drug interactions. A. Could cause additional sedation but are less likely to be the sole cause. Anxiety. C. Or dehydration. D. Is not the most probable explanation. 13. A patient taking metformin for type 2 diabetes begins to develop weakness and fatigue. Which serious adverse effect should the nurse assess for? A. Hypoglycemia. B. Lactic acidosis. C. Dehydration. D. Hepatotoxicity. Answer: B. Lactic acidosis. Rationale: lactic acidosis. B. Is a rare but serious side effect of metformin, especially in patients with renal impairment. Hypoglycemia. A. Is unlikely because metformin doesn't cause low blood sugar on its own. Dehydration. C. And hepatotoxicity. D. Are not typical concerns for metformin. 14. Which of the following is the primary side effect of corticosteroids like prednisone? A. Hyperkalemia. B. Hyperglycemia. C. Hypoglycemia. D. Weight loss. Answer: B. Hyperglycemia. Rationale: corticosteroids like prednisone can cause hyperglycemia, B, by stimulating gluconeogenesis. Hyperkalemia, A, and hypoglycemia, C, are not common side effects, and weight loss, D, is not typically associated with corticosteroid therapy, which may actually cause weight gain. 15. A patient receiving chemotherapy develops severe nausea and vomiting. Which drug class would most likely be prescribed to manage these symptoms? A. Antihistamines. B. Antidepressants. C. Antiemetics. D. Antacids. Answer: C. Antiemetics. Rationale: antiemetics C, such as ondansetron, are used to prevent and treat nausea and vomiting associated with chemotherapy. Antihistamines, A, can cause drowsiness, but are not typically effective for chemotherapy-induced nausea. Antidepressants, B, are not used for nausea. Antacids, D, are not effective for this type of nausea. 16. A nurse is administering furosemide to a patient with heart failure. Which of the following should be monitored closely? A. Blood glucose. B. Blood pressure. C. Serum potassium levels. D. Liver function tests. Answer: C. Serum potassium levels. Rationale: furosemide, a loop diuretic, can cause hypokalemia, C, so potassium levels should be monitored. Blood glucose, A, blood pressure, B, and liver function tests, D, are important but not as directly affected by furosemide as potassium. 17. A patient on clonidine for hypertension reports feeling excessively sleepy. What is a likely cause of this side effect? A. Drug interaction. B. Central nervous system depression. C. Dehydration. D. Anxiety from hypertension. Answer: B. Central nervous system depression. Rationale: clonidine, an alpha-2 agonist, causes central nervous system depression, B, leading to sedation and drowsiness. Drug interaction, A, could cause enhanced sedation, but central nervous system depression, B, is the most likely cause. Dehydration, C, and anxiety, D, are not the main side effects. 18. A patient on insulin for type 1 diabetes is at risk for which of the following adverse effects? A. Hyperkalemia. B. Hypoglycemia. C. Hypertension. D. Weight loss. Answer: B. Hypoglycemia. Rationale: hypoglycemia, B, is the primary risk associated with insulin therapy, especially if the patient does not eat enough or exercises too much. Hyperkalemia, A, and hypertension, C, are not typically associated with insulin. Weight loss, D, can occur in poorly controlled diabetes, but is not a common side effect of insulin therapy itself. 19. A patient is taking a beta blocker for hypertension. Which of the following side effects should be monitored? A. Bradycardia. B. Hyperthermia. C. Diarrhea. D. Hyperglycemia. Answer: A. Bradycardia. Rationale: beta blockers can cause bradycardia, A, due to their effect on heart rate. Hyperthermia, B, diarrhea, C, and hyperglycemia, D, are not common side effects of beta blockers. 20. A 50-year-old woman is prescribed raloxifene for osteoporosis. What is an important side effect to monitor for in this patient? A. Hypertension. B. Deep vein thrombosis, DVT. C. Weight gain. D. Decreased libido. Answer: B. Deep vein thrombosis, DVT. Rationale: raloxifene, a selective estrogen receptor modulator, SERM, can increase the risk of deep vein thrombosis, B. Hypertension, A, weight gain, C, and decreased libido, D, are not typical side effects of raloxifene. 21. A patient is prescribed a calcium channel blocker for hypertension. Which side effect should the nurse monitor for? A. Constipation. B. Insomnia. C. Hyperkalemia. D. Tachycardia. Answer: A. Constipation. Rationale: calcium channel blockers, such as verapamil, are commonly associated with constipation, A. Insomnia, B. hyperkalemia, C, and tachycardia, D, are not typically associated with this drug class. 22. A patient with asthma is prescribed albuterol for shortness of breath. Which side effect should the nurse warn the patient about? A. Tremors. B. Drowsiness. C. Weight gain. D. Increased appetite. Answer: A. Tremors. Rationale: albuterol, a beta-2 agonist, commonly causes tremors, A, as a side effect. Drowsiness, B, weight gain, C, and increased appetite, D, are not typical side effects of albuterol. 23. A patient taking carbamazepine for seizures is at risk for which of the following adverse effects? A. Hypertension. B. Agranulocytosis. C. Weight loss. D. Hyperglycemia. Answer: B. Agranulocytosis. Rationale: carbamazepine can cause agranulocytosis, B, a serious decrease in white blood cell count. Hypertension, A, weight loss, C, and hyperglycemia, D, are not commonly associated with carbamazepine. 24. A nurse is caring for a patient who has just been started on a monoamine oxidase inhibitor, MALI. Which food should the patient avoid? A. Milk. B. Aged cheese. C. Chicken. D. Fresh fruits. Answer: B. Aged cheese. Rationale: aged cheese contains tyramine, which can cause hypertensive crisis when combined with MALIs. B. Milk, A, chicken, C, and fresh fruits, D, do not contain significant amounts of tyramine. 25. A patient is prescribed a selective serotonin reuptake inhibitor, SSRI, for depression. What is a common side effect of SSRIs? A. Erectile dysfunction. B. Increased appetite. C. Insomnia. D. Weight loss. Answer: A. Erectile dysfunction. Rationale: SSRIs are commonly associated with erectile dysfunction, A, and other sexual side effects. Increased appetite, B, insomnia, C, and weight loss, D, are less common with SSRIs. 26. A nurse is caring for a patient receiving warfarin therapy. What lab value should be closely monitored? A. White blood cell count. B. Platelet count. C's international normalized ratio, INR. D. Blood glucose level. Answer: C's international normalized ratio, INR. Rationale: warfarin therapy requires monitoring the INR-C to ensure the patient's blood is not too thin or too thick. WBC count, A, platelet count, B, and blood glucose levels, D, are not routinely monitored for warfarin therapy. 27. A nurse is administering a calcium supplement to a patient. Which of the following side effects should the nurse monitor for? A. Hyperkalemia. B. Hypercalcemia. C. Hypoglycemia. D. Hypotension. Answer: B. Hypercalcemia. Rationale: calcium supplements can lead to hypercalcemia, B, especially if taken in excess. Hyperkalemia, A, hypoglycemia, C, and hypotension, D, are not commonly associated with calcium supplementation. 28. A patient taking a nonsteroidal anti-inflammatory drug, NSAID, for pain is at risk for which of the following side effects? A. Renal toxicity. B. Hypotension. C. Hyperglycemia. D. Constipation. Answer: A. Renal toxicity. Rationale: NSAIDs are associated with renal toxicity, A, and can cause kidney damage, especially with long-term use. Hypotension, B, hyperglycemia, C, and constipation, D, are not commonly linked with NSAID use. 29. A nurse is caring for a patient on a high dose of aspirin. Which of the following side effects should the nurse monitor for? A. Tinnitus. B. Hypoglycemia. C. Weight loss. D. Hypotension. Answer: A. Tinnitus. Rationale: high doses of aspirin can cause tinnitus, A, which is a sign of aspirin toxicity. Hypoglycemia, B, weight loss, C, and hypotension, D, are not commonly associated with aspirin. 30. A nurse is administering gentamicin to a patient. Which of the following should the nurse monitor closely? A. Serum creatinine levels. B. Blood glucose levels. C. White blood cell count. D. Platelet count. Answer: A. Serum creatinine levels. Rationale: gentamicin is an aminoglycoside that can cause nephrotoxicity, so serum creatinine levels, A, should be closely monitored. Blood glucose, B, WBC count, C, and platelet count, D, are not directly affected by gentamicin. 31. A patient is prescribed digoxin for atrial fibrillation. Which of the following symptoms is indicative of digoxin toxicity? A. Nausea and vomiting. B. Bradycardia and hypotension. C. Muscle weakness and fatigue. D. Insomnia and headache. Answer: A. Nausea and vomiting. Rationale: nausea and vomiting, A, are early signs of digoxin toxicity. Bradycardia and hypotension, B, can also occur but are not as specific to toxicity. Muscle weakness and fatigue, C, and insomnia, D, are not typically the first signs of digoxin toxicity. 32. A patient on acetaminophen for pain asks the nurse about potential risks. What is the most serious side effect associated with excessive acetaminophen use? A. Hepatotoxicity. B. Gastric ulcers. C. Renal failure. D. Hypertension. Answer: A. Hepatotoxicity. Rationale: acetaminophen in high doses is primarily associated with hepatotoxicity, A, which can lead to liver failure. Gastric ulcers, B, renal failure, C, and hypertension, D, are not common with acetaminophen use unless there are other comorbidities or drug interactions. 33. A nurse is administering an angiotensin-converting enzyme, ACE, inhibitor. Which of the following is a common side effect of ACE inhibitors? A. Persistent cough. B. Weight gain. C. Hypoglycemia. D. Insomnia. Answer: A. Persistent cough. Rationale: a persistent dry cough, A, is a common side effect of ACE inhibitors due to bradykinin accumulation. Weight gain, B, hypoglycemia, C, and insomnia, D, are not typically associated with ACE inhibitors. 34. A nurse is caring for a patient who is receiving lithium for bipolar disorder. Which of the following is the most important assessment? A. Renal function. B. Liver function. C. Serum calcium levels. D. Respiratory rate. Answer: A. Renal function. Rationale: lithium is primarily excreted by the kidneys, and renal function, A, should be closely monitored. Liver function, B, serum calcium, C, and respiratory rate, D, are not as directly impacted by lithium therapy. 35. A patient is taking warfarin and begins to develop dark, tarry stools. What should the nurse suspect? A. Vitamin K overdose. B. Bleeding complication. C. Gallbladder issues. D. Iron deficiency. Answer: B. Bleeding complication. Rationale: dark, tarry stools, B, are indicative of gastrointestinal bleeding, a potential side effect of warfarin therapy. Vitamin K overdose, A, would lead to clotting problems, not bleeding. Gallbladder issues, C, and iron deficiency, D, are not typically associated with warfarin use. 36. A patient is prescribed a thiazide diuretic. What is a common side effect that the nurse should educate the patient about? A. Hyperkalemia. B. Hypokalemia. C. Hypercalcemia. D. Hypotension. Answer: B. Hypokalemia. Rationale: thiazide diuretics can cause hypokalemia, B, as they increase potassium excretion. Hyperkalemia, A, is more common with potassium-sparing diuretics. Hypercalcemia, C, and hypotension, D, can occur but are less common side effects of thiazide diuretics. 37. A nurse is caring for a patient on morphine for pain relief. Which of the following side effects should the nurse closely monitor for? A. Respiratory depression. B. Weight gain. C. Insomnia. D. Hypertension. Answer: A. Respiratory depression. Rationale: respiratory depression, A, is a serious side effect of opioid use like morphine. Weight gain, B, insomnia, C, and hypertension, D, are not common side effects of morphine. 38. A patient with tuberculosis is prescribed rifampin. Which side effect should the nurse monitor for? A. Orange-red urine. B. Weight loss. C. Constipation. D. Insomnia. Answer: A. Orange-red urine. Rationale: rifampin can cause orange-red discoloration of urine. A. Sweat and tears. Weight loss. B. Constipation. C. And insomnia. D. Are not typical side effects of rifampin. 39. A nurse is educating a patient on the use of oral contraceptives. Which of the following should the nurse include in the teaching plan? A. Oral contraceptives may increase the risk of thromboembolism. B. Oral contraceptives should be taken with food to avoid stomach upset. C. Oral contraceptives may cause permanent infertility. D. Oral contraceptives should be discontinued during menstruation. Answer: A. Oral contraceptives may increase the risk of thromboembolism. Rationale: oral contraceptives increase the risk of thromboembolism. A. Due to changes in clotting factors. They do not cause permanent infertility. C. Should not be discontinued during menstruation. D. And can be taken with or without food. B. But food is not necessary to avoid stomach upset. 40. A patient is prescribed valproic acid for seizures. Which of the following is a common side effect of this medication? A. Weight gain. B. Weight loss. C. Hair loss. D. Hypertension. Answer: A. Weight gain. Rationale: valproic acid can cause weight gain. A. In some patients. Weight loss. B. Hair loss. C. And hypertension. D. Are not typical side effects of valproic acid. 41. A nurse is caring for a patient who has been prescribed lorazepam. Which side effect should the nurse anticipate? A. Insomnia. B. Anxiety. C. Drowsiness. D. Weight loss. Answer: C. Drowsiness. Rationale: lorazepam, a benzodiazepine, can cause sedation and drowsiness. C. As common side effects. Insomnia. A. Anxiety. B. And weight loss. D. Are not typically associated with lorazepam. 42. A nurse is caring for a patient receiving antipsychotic medication. Which side effect should the nurse monitor for? A. Extrapyramidal symptoms. B. Hypoglycemia. C. Constipation. D. Hyperkalemia. Answer: A. Extrapyramidal symptoms. Rationale: antipsychotic medications can cause extrapyramidal symptoms. A. Such as tremors, rigidity, and tardive dyskinesia. Hypoglycemia. B. Constipation. C. And hyperkalemia. D. Are not typical side effects. 43. A patient with chronic obstructive pulmonary disease, COPD, is prescribed ipratropium bromide. What side effect should the nurse monitor for? A. Tachycardia. B. Dry mouth. C. Drowsiness. D. Constipation. Answer: B. Dry mouth. Rationale: ipratropium bromide, an anticholinergic, commonly causes dry mouth. B. As a side effect. Tachycardia. A. Drowsiness. C. And constipation. D. Are not common with this medication. 44. A patient taking amitriptyline for depression reports dry mouth and blurred vision. Which side effect is the patient most likely experiencing? A. Anticholinergic effects. B. Hypertensive crisis. C. Serotonin syndrome. D. Hypotension. Answer: A. Anticholinergic effects. Rationale: amitriptyline, a tricyclic antidepressant, has anticholinergic effects. A. Including dry mouth and blurred vision. Hypertensive crisis. B. Serotonin syndrome. C. And hypotension. D. Are not typical with this medication. 45. A nurse is caring for a patient on a high-dose aspirin regimen. Which of the following side effects should the nurse monitor for? A. Tinnitus. B. Diarrhea. C. Weight gain. D. Hypertension. Answer: A. Tinnitus. Rationale: high-dose aspirin therapy can cause tinnitus. A. A sign of toxicity. Diarrhea. B. Weight gain. C. And hypertension. D. Are not common side effects of aspirin. 46. A patient is taking prednisone for inflammation. What should the nurse monitor for as a side effect of long-term prednisone therapy? A. Hyperglycemia. B. Hypotension. C. Diarrhea. D. Hyperkalemia. Answer: A. Hyperglycemia. Rationale: prednisone, a corticosteroid, can increase blood sugar levels, leading to hyperglycemia. A. Hypotension. B. Diarrhea. C. And hyperkalemia. D. Are not typical side effects of prednisone. 47. A nurse is caring for a patient who is receiving theophylline for asthma. Which of the following signs indicates the patient may be experiencing toxicity? A. Nausea and vomiting. B. Confusion and hallucinations. C. Tachycardia and restlessness. D. Hypercalcemia. Answer: C. Tachycardia and restlessness. Rationale: theophylline toxicity can cause tachycardia and restlessness. C. As well as nausea and vomiting. A. Confusion and hallucinations. B. Are less common, and hypercalcemia. D. Is not typically associated with theophylline toxicity. 48. A nurse is administering morphine to a patient post-surgery. What side effect is the nurse most likely to monitor for? A. Respiratory depression. B. Weight loss. C. Diarrhea. D. Hypertension. Answer: A. Respiratory depression. Rationale: respiratory depression, A, is a serious side effect of opioids such as morphine. Weight loss, B, diarrhea, C, and hypertension, D, are not common side effects of morphine. 49. A patient is prescribed atorvastatin for high cholesterol. Which side effect should the nurse monitor for? A. Muscle pain and weakness. B. Weight gain. C. Dry mouth. D. Increased appetite. Answer: A. Muscle pain and weakness. Rationale: statins like atorvastatin can cause muscle pain and weakness. A. As a side effect. Weight gain. B. Dry mouth. C. And increased appetite. D. Are not typically associated with atorvastatin. 50. A nurse is caring for a patient who is taking an anticoagulant. What is the most serious side effect the nurse should monitor for? A. Bleeding. B. Hypertension. C. Tachycardia. D. Weight loss. Answer: A. Bleeding. Rationale: bleeding, A, is the most serious side effect of anticoagulant therapy and should be monitored closely. Hypertension, B, tachycardia, C, and weight loss, D, are not typical side effects of anticoagulants. 51. A patient is prescribed warfarin therapy. Which of the following foods should the patient avoid due to their effect on warfarin? A. Leafy green vegetables. B. Dairy products. C. Citrus fruits. D. Fish and shellfish. Answer: A. Leafy green vegetables. Rationale: leafy green vegetables, A, are high in vitamin K, which can interfere with the anticoagulant effect of warfarin. Dairy products, B, citrus fruits, C, and fish/shellfish, D, do not significantly affect warfarin therapy. 52. A nurse is caring for a patient receiving potassium supplements. Which of the following is the most serious side effect associated with potassium supplementation? A. Hyperkalemia. B. Hypoglycemia. C. Renal failure. D. Weight loss. Answer: A. Hyperkalemia. Rationale: potassium supplements can cause hyperkalemia, A, which can lead to dangerous arrhythmias. Hypoglycemia, B, renal failure, C, and weight loss, D, are not typical side effects of potassium supplementation unless there are underlying conditions. 53. A patient is receiving phenytoin for seizure control. What should the nurse monitor for as a potential side effect? A. Gingival hyperplasia. B. Hypoglycemia. C. Weight gain. D. Diarrhea. Answer: A. Gingival hyperplasia. Rationale: phenytoin can cause gingival hyperplasia, A, an overgrowth of gum tissue. Hypoglycemia, B, weight gain, C, and diarrhea, D, are not common side effects of phenytoin. 54. A nurse is caring for a patient on lisinopril therapy. Which of the following side effects should the nurse monitor for? A. Persistent cough. B. Weight gain. C. Hypertension. D. Seizures. Answer: A. Persistent cough. Rationale: a persistent dry cough, A, is a common side effect of ACE inhibitors like lisinopril. Weight gain, B, hypertension, C, and seizures, D, are not typically associated with lisinopril. 55. A nurse is administering ibuprofen to a patient. Which of the following is the most serious side effect the nurse should monitor for? A. Gastrointestinal bleeding. B. Weight gain. C. Diarrhea. D. Tachycardia. Answer: A. Gastrointestinal bleeding. Rationale: NSAIDs like ibuprofen can cause gastrointestinal bleeding, and ulceration, especially with long-term use. Weight gain, B. Diarrhea, C. And tachycardia, D. are not common serious side effects of ibuprofen. 56. A nurse is caring for a patient who is prescribed metformin for type 2 diabetes. Which of the following side effects should the nurse monitor for? A. Lactic acidosis. B. Hypertension. C. Hypoglycemia. D. Hyperkalemia. Answer: A. Lactic acidosis. Rationale: metformin can cause lactic acidosis, a potentially life-threatening condition, especially in patients with renal impairment. Hypertension, B. Hypoglycemia, C. And hyperkalemia, D. are less common with metformin. 57. A patient is receiving lorazepam for anxiety. Which of the following side effects should the nurse be alert for? A. Drowsiness. B. Constipation. C. Hyperactivity. D. Hypertension. Answer: A. Drowsiness. Rationale: lorazepam, a benzodiazepine, can cause drowsiness, A. as a side effect. Constipation, B. Hyperactivity, C. And hypertension, D. are not typical side effects of lorazepam. 58. A nurse is administering amiodarone to a patient. Which of the following side effects should the nurse monitor for? A. Pulmonary toxicity. B. Weight loss. C. Insomnia. D. Hypertension. Answer: A. Pulmonary toxicity. Rationale: amiodarone is known to cause pulmonary toxicity, A, which can lead to lung damage. Weight loss, B. Insomnia, C. And hypertension, D. are not typical side effects of amiodarone. 59. A nurse is caring for a patient on warfarin therapy. Which of the following signs should the nurse recognize as a sign of excessive anticoagulation? A. Hematuria. B. Tachycardia. C. Nausea. D. Weight gain. Answer: A. Hematuria. Rationale: hematuria, A, is a sign of excessive anticoagulation and bleeding in patients on warfarin therapy. Tachycardia, B, nausea, C, and weight gain, D, are not signs of excessive anticoagulation. 60. A patient on long-term prednisone therapy reports new-onset back pain. Which of the following side effects should the nurse suspect? A. Osteoporosis. B. Diarrhea. C. Hypoglycemia. D. Urinary retention. Answer: A. Hematuria. Rationale: hematuria, A, is a sign of excessive anticoagulation and bleeding in patients on warfarin therapy. Tachycardia, B, nausea, C, and weight gain, D, are not signs of excessive anticoagulation. 61. A nurse is caring for a patient receiving phenytoin for seizures. Which of the following instructions should the nurse provide regarding phenytoin therapy? A. Take the medication with food. B. Stop the medication immediately if you experience drowsiness. C. Drink grapefruit juice to enhance the medication's effectiveness. D. Do not skip doses or stop taking the medication suddenly. Answer: A. Osteoporosis. Rationale: long-term use of corticosteroids like prednisone can cause osteoporosis, A, which may lead to fractures. Diarrhea, B, hypoglycemia, C, and urinary retention, D, are not typical side effects of prednisone. 62. A patient is prescribed clopidogrel following a myocardial infarction. Which of the following side effects should the nurse monitor for? A. Bleeding. B. Hypertension. C. Constipation. D. Weight loss. Answer: A. Bleeding. Rationale: clopidogrel, an antiplatelet medication, increases the risk of bleeding, A. Hypertension, B, constipation, C, and weight loss, D, are not common side effects of clopidogrel. 63. A nurse is caring for a patient receiving digoxin. Which of the following should the nurse assess to monitor for signs of toxicity? A. Heart rate. B. Blood pressure. C. Respiratory rate. D. Oxygen saturation. Answer: A. Heart rate. Rationale: digoxin toxicity often presents with changes in heart rate, such as bradycardia, A. Blood pressure, B. Respiratory rate, C. And oxygen saturation, D. Are less directly affected by digoxin toxicity. 64. A nurse is educating a patient on the use of statins. Which of the following instructions is most important for the nurse to include? A. Avoid grapefruit juice. B. Increase vitamin K intake. C. Take the medication on an empty stomach. D. Increase fluid intake. Answer: A. Avoid grapefruit juice. Rationale: grapefruit juice, A. Can interfere with the metabolism of statins and increase the risk of side effects. Vitamin K intake, B. Should be consistent, but does not need to be increased. Statins are typically taken with food, not on an empty stomach, C. Increasing fluid intake, D. Is not a specific requirement for statin therapy. 65. A patient on lithium therapy reports tremors and confusion. What should the nurse suspect? A. Lithium toxicity. B. Hyperthyroidism. C. Dehydration. D. Anxiety. Answer: A. Avoid grapefruit juice. Rationale: grapefruit juice, A. Can interfere with the metabolism of statins and increase the risk of side effects. Vitamin K intake, B. Should be consistent, but does not need to be increased. Statins are typically taken with food, not on an empty stomach, C. Increasing fluid intake, D. Is not a specific requirement for statin therapy. 66. A nurse is caring for a patient receiving ciprofloxacin. Which of the following side effects should the nurse monitor for? A. Tendon rupture. B. Weight gain. C. Hypertension. D. Constipation. Answer: A. Tendon rupture. Rationale: ciprofloxacin, a fluoroquinolone, has been associated with an increased risk of tendon rupture, A. Especially in elderly patients. Weight gain, B. Hypertension, C. And constipation, D. Are not common side effects of ciprofloxacin. 67. A patient on anticoagulation therapy reports blood in their stool. What should the nurse do next? A. Assess for signs of bleeding. B. Instruct the patient to increase fluid intake. C. Administer vitamin K. D. Stop the anticoagulant immediately. Answer: A. Assess for signs of bleeding. Rationale: blood in the stool is a sign of potential gastrointestinal bleeding, A. And the nurse should assess further before taking action. Increasing fluid intake, B. Administering vitamin K, C. And stopping the anticoagulant, D. Are not immediate interventions for gastrointestinal bleeding. 68. A nurse is educating a patient about the side effects of corticosteroid therapy. Which of the following should the nurse emphasize? A. Risk of infection. B. Risk of anemia. C. Risk of hypoglycemia. D. Risk of hypotension. Answer: A. Risk of infection. Rationale: corticosteroids increase the risk of infection, A. By suppressing the immune system. Anemia, B. Hypoglycemia, C. And hypotension, D. Are not common side effects of corticosteroids. 69. A patient is receiving rifampin for tuberculosis. Which of the following side effects should the nurse monitor for? A. Orange discoloration of body fluids. B. Tachycardia. C. Edema. D. Weight loss. Answer: A. Orange discoloration of body fluids. Rationale: rifampin causes an orange-red discoloration of urine, sweat, and tears, A. Tachycardia, B. Edema, C. And weight loss, D. Are not common side effects. 70. A patient taking nitroglycerin for angina reports a headache after each dose. What should the nurse explain to the patient? A. Headaches are a common side effect. B. The medication should be stopped. C. The patient should take aspirin for pain relief. D. The dosage needs to be increased. Answer: A. Headaches are a common side effect. Rationale: headaches, A. Are a common side effect of nitroglycerin due to vasodilation. The medication should not be stopped, B. Aspirin is not recommended for this pain, C, and increasing the dosage, D, would likely worsen the side effect. 71. A patient is taking hydrochlorothiazide for hypertension. Which of the following side effects should the nurse monitor for? A. Hypokalemia. B. Hyperkalemia. C. Weight gain. D. Hypercalcemia. Answer: A. Hypokalemia. Rationale: hydrochlorothiazide, a thiazide diuretic, can cause hypokalemia, A, as it increases potassium excretion. Hyperkalemia, B, weight gain, C, and hypercalcemia, D, are not common side effects of hydrochlorothiazide. 72. A nurse is caring for a patient receiving clindamycin for an infection. Which of the following side effects should the nurse monitor for? A. Diarrhea. B. Weight loss. C. Hypertension. D. Constipation. Answer: A. Diarrhea. Rationale: clindamycin can cause antibiotic-associated diarrhea, A, including Clostridium difficile infection. Weight loss, B, hypertension, C, and constipation, D, are not typical side effects of clindamycin. 73. A nurse is educating a patient receiving lithium therapy. Which of the following is the most important instruction for the nurse to provide? A. Maintain a consistent salt intake. B. Avoid foods high in potassium. C. Drink grapefruit juice to increase effectiveness. D. Take the medication on an empty stomach. Answer: A. Maintain a consistent salt intake. Rationale: lithium levels can be affected by changes in sodium intake, A, so the patient should maintain a consistent salt intake. Potassium, B, does not significantly affect lithium. Grapefruit juice, C, can interfere with many drugs, and lithium can be taken with or without food, D. 74. A patient on warfarin therapy is at risk for bleeding. Which of the following interventions should the nurse implement to minimize the risk? A. Avoid contact sports. B. Increase vitamin K-rich foods. C. Increase physical activity. D. Take the medication at bedtime. Answer: A. Avoid contact sports. Rationale: patients on warfarin should avoid activities that increase the risk of injury or bleeding, such as contact sports, A. Increasing vitamin K-rich foods, B, can interfere with warfarin's effectiveness. Physical activity, C, is not contraindicated unless associated with injury, and timing the medication at bedtime, D, is not a critical factor. 75. A nurse is caring for a patient who is taking zolpidem for insomnia. Which of the following side effects should the nurse monitor for? A. Drowsiness. B. Insomnia. C. Hypertension. D. Weight gain. Answer: A. Drowsiness. Rationale: zolpidem, a sedative hypnotic, can cause drowsiness, A, as a common side effect. It is used to treat insomnia, so insomnia, B, is not a side effect. Hypertension, C, and weight gain, D, are not typical side effects of zolpidem. 76. A patient is receiving enalapril for hypertension. What should the nurse monitor for as a potential side effect of ACE inhibitors? A. Persistent dry cough. B. Hyperglycemia. C. Hypokalemia. D. Tachycardia. Answer: A. Persistent dry cough. Rationale: a persistent dry cough, A, is a common side effect of ACE inhibitors like enalapril. Hyperglycemia, B, hypokalemia, C, and tachycardia, D, are not typically associated with ACE inhibitors. 77. A patient is prescribed rifampin for tuberculosis. Which of the following should the nurse advise the patient regarding this medication? A. Urine, sweat, and tears may turn orange. B. Avoid alcohol due to risk of liver damage. C. Limit protein intake. D. Increase vitamin D intake. Answer: A. Urine, sweat, and tears may turn orange. Rationale: rifampin causes a harmless orange-red discoloration of urine, sweat, and tears, A. Avoiding alcohol, B, is important due to the risk of liver toxicity, but this is not the primary instruction. Limiting protein, C, and increasing vitamin D, D, are not specific recommendations for rifampin therapy. 78. A nurse is caring for a patient on atorvastatin therapy. Which of the following side effects should the nurse be alert for? A. Muscle pain and weakness. B. Nausea and vomiting. C. Diarrhea. D. Hypertension. Answer: A. Muscle pain and weakness. Rationale: statins such as atorvastatin can cause muscle pain and weakness. A condition known as myopathy. Nausea and vomiting. B. Diarrhea. C. And hypertension. D. Are not common side effects of atorvastatin. 79. A nurse is administering acetaminophen to a patient. Which of the following should the nurse monitor for as a potential side effect of this medication? A. Liver toxicity. B. Hypertension. C. Constipation. D. Weight gain. Answer: A. Liver toxicity. Rationale: acetaminophen can cause liver toxicity. A. Especially with overdose or prolonged use. Hypertension. B. Constipation. C. And weight gain. D. Are not common side effects of acetaminophen. 80. A patient is receiving metoprolol for hypertension. Which of the following side effects should the nurse monitor for? A. Bradycardia. B. Hypotension. C. Weight loss. D. Increased appetite. Answer: A. Bradycardia. Rationale: metoprolol, a beta blocker, can cause bradycardia. A. Which is a decrease in heart rate. Hypotension. B. Is a possible side effect, but is less common than bradycardia. Weight loss. C. And increased appetite. D. Are not typical side effects of metoprolol. 81. A nurse is administering furosemide to a patient. Which of the following side effects should the nurse monitor for? A. Hypokalemia. B. Hyperglycemia. C. Hypercalcemia. D. Weight gain. Answer: A. Hypokalemia. Rationale: furosemide, a loop diuretic, can cause hypokalemia. A. As it increases potassium excretion. Hyperglycemia. B. Hypercalcemia. C. And weight gain. D. Are not common side effects of furosemide. 82. A nurse is caring for a patient who is prescribed gabapentin for neuropathic pain. Which of the following side effects should the nurse monitor for? A. Drowsiness. B. Weight loss. C. Hyperactivity. D. Tachycardia. Answer: A. Drowsiness. Rationale: gabapentin, an anticonvulsant, can cause drowsiness. A. As a side effect. Weight loss. B. Hyperactivity. C. And tachycardia. D. Are not typical side effects of gabapentin. 83. A nurse is educating a patient about taking tetracycline for an infection. Which of the following should the nurse instruct the patient to avoid? A. Dairy products. B. Whole grains. C. Lean meats. D. Citrus fruits. Answer: A. Dairy products. Rationale: tetracycline can bind to calcium in dairy products. A. Reducing its absorption and effectiveness. Whole grains. B. Lean meats. C. And citrus fruits. D. Do not interfere with tetracycline absorption. 84. A patient is receiving gentamicin for an infection. Which of the following is a potential side effect of gentamicin therapy? A. Ototoxicity. B. Hypertension. C. Hyperglycemia. D. Constipation. Answer: A. Ototoxicity. Rationale: gentamicin is an aminoglycoside antibiotic known to cause ototoxicity. A. Which can lead to hearing loss or balance issues. Hypertension. B. Hyperglycemia. C. And constipation. D. Are not common side effects of gentamicin. 85. A nurse is administering albuterol for asthma. Which of the following side effects should the nurse monitor for? A. Tachycardia. B. Hypoglycemia. C. Drowsiness. D. Constipation. Answer: A. Tachycardia. Rationale: albuterol, a bronchodilator, can cause tachycardia. A. As a side effect. Hypoglycemia. B. Drowsiness. C. And constipation. D. Are not common side effects of albuterol. 86. A nurse is caring for a patient who is prescribed prednisone. Which of the following should the nurse monitor for as a potential side effect? A. Hyperglycemia. B. Hypoglycemia. C. Hypotension. D. Weight loss. Answer: A. Hyperglycemia. Rationale: prednisone, a corticosteroid, can cause hyperglycemia. A. It does not typically cause hypoglycemia, B. Hypotension, C. Or weight loss, D. 87. A patient is receiving isoniazid for tuberculosis. Which of the following side effects should the nurse monitor for? A. Peripheral neuropathy. B. Hyperkalemia. C. Weight gain. D. Hypertension. Answer: A. Peripheral neuropathy. Rationale: isoniazid can cause peripheral neuropathy, A. due to its effect on nerve function. Hyperkalemia, B. Weight gain, C. And hypertension, D. are not common side effects of isoniazid. 88. A nurse is educating a patient receiving a proton pump inhibitor, PPI, for gastroesophageal reflux disease, GERD. Which of the following should the nurse advise? A. Take the medication before meals. B. Avoid eating after 6 p.m. C. Limit water intake. D. Drink alcohol in moderation. Answer: A. Take the medication before meals. Rationale: PPIs like omeprazole should be taken before meals. A. To maximize effectiveness. Avoiding eating after 6 p.m. B. is not necessary, and limiting water intake. C. And drinking alcohol. D. are not specific recommendations for PPI therapy. 89. A nurse is caring for a patient on anticoagulation therapy. Which of the following should the nurse instruct the patient to avoid? A. Vitamin K-rich foods. B. High-fiber foods. C. Low-sodium foods. D. High-calcium foods. Answer: A. Vitamin K-rich foods. Rationale: vitamin K-rich foods, A. can interfere with the effectiveness of anticoagulants like warfarin. High-fiber, B. Low-sodium, C. And high-calcium, D. foods are not contraindicated with anticoagulation therapy. 90. A nurse is caring for a patient who is prescribed cyclophosphamide for cancer treatment. Which of the following should the nurse monitor for as a potential side effect? A. Leukopenia. B. Hypertension. C. Weight gain. D. Hypoglycemia. Answer: A. Leukopenia. Rationale: cyclophosphamide, a chemotherapy agent, can cause leukopenia, A. which is a reduction in white blood cell count. Hypertension, B. Weight gain, C. And hypoglycemia, D. are not common side effects of cyclophosphamide. 91. A nurse is educating a patient who is prescribed methotrexate for rheumatoid arthritis. Which of the following should the nurse monitor for? A. Liver toxicity. B. Hypertension. C. Hyperglycemia. D. Weight loss. Answer: A. Liver toxicity. Rationale: methotrexate can cause liver toxicity, A. so liver function tests should be monitored. Hypertension, B. Hyperglycemia, C. And weight loss, D. are not common side effects of methotrexate. 92. A nurse is caring for a patient who is receiving digoxin for heart failure. Which of the following should the nurse monitor for as a potential side effect? A. Bradycardia. B. Tachycardia. C. Hypertension. D. Hyperkalemia. Answer: A. Bradycardia. Rationale: digoxin can cause bradycardia, A. a slow heart rate. Tachycardia, B. Hypertension, C. And hyperkalemia, D. are not common side effects of digoxin. 93. A nurse is educating a patient who is starting atorvastatin therapy. Which of the following side effects should the nurse emphasize? A. Muscle pain. B. Drowsiness. C. Hypoglycemia. D. Weight gain. Answer: A. Muscle pain. Rationale: atorvastatin and other statins can cause muscle pain, A. which is a potential side effect known as myopathy. Drowsiness, B. Hypoglycemia, C. And weight gain, D. are not common side effects of atorvastatin. 94. A patient is prescribed amoxicillin for an infection. The nurse should monitor for which of the following adverse effects? A. Allergic reaction. B. Weight loss. C. Hyperglycemia. D. Hypotension. Answer: A. Allergic reaction. Rationale: amoxicillin can cause an allergic reaction, A. including rash, hives, or anaphylaxis. Weight loss, B. Hyperglycemia, C. And hypotension, D. are not common adverse effects of amoxicillin. 95. A nurse is administering a dose of morphine to a patient in severe pain. Which of the following side effects should the nurse monitor for? A. Respiratory depression. B. Hypertension. C. Hyperglycemia. D. Tachycardia. Answer: A. Respiratory depression. Rationale: morphine and other opioids can cause respiratory depression, which is a potentially life-threatening side effect. Hypertension, B, hyperglycemia, C, and tachycardia, D, are not common side effects of morphine. 96. A nurse is caring for a patient taking warfarin. Which of the following foods should the patient avoid? A. Leafy green vegetables. B. Dairy products. C. Citrus fruits. D. Whole grains. Answer: A. Leafy green vegetables. Rationale: leafy green vegetables are high in vitamin K, which can interfere with the effectiveness of warfarin. Dairy products, B, citrus fruits, C, and whole grains, D, do not have significant interactions with warfarin. 97. A nurse is caring for a patient who is prescribed prednisone. Which of the following side effects should the nurse emphasize? A. Risk of infection. B. Hyperkalemia. C. Hypoglycemia. D. Constipation. Answer: A. Risk of infection. Rationale: prednisone, a corticosteroid, suppresses the immune system, increasing the risk of infection. A. Hyperkalemia, B, hypoglycemia, C, and constipation, D, are not common side effects of prednisone. 98. A patient is prescribed lorazepam for anxiety. Which of the following side effects should the nurse monitor for? A. Drowsiness. B. Increased energy. C. Weight loss. D. Hypertension. Answer: A. Drowsiness. Rationale: lorazepam, a benzodiazepine, can cause drowsiness, which is a common side effect. Increased energy, B, weight loss, C, and hypertension, D, are not typical side effects of lorazepam. 99. A nurse is caring for a patient who is taking ciprofloxacin. Which of the following side effects should the nurse monitor for? A. Tendon rupture. B. Constipation. C. Weight gain. D. Tachycardia. Answer: A. Tendon rupture. Rationale: ciprofloxacin, a fluoroquinolone, can increase the risk of tendon rupture, especially in elderly patients. Constipation, B, weight gain, C, and tachycardia, D, are not common side effects of ciprofloxacin. 100. A patient is prescribed vancomycin for an infection. The nurse should monitor for which of the following side effects? A. Red man syndrome. B. Hypotension. C. Bradycardia. D. Hyperkalemia. Answer: A. Red man syndrome. Rationale: vancomycin can cause red man syndrome, a reaction that includes rash, flushing, and hypotension. Hypotension, B, bradycardia, C, and hyperkalemia, D, are not common side effects of vancomycin. 101. A nurse is caring for a patient on levothyroxine therapy. Which of the following should the nurse monitor for? A. Hyperthyroidism symptoms. B. Hypotension. C. Hyperglycemia. D. Weight gain. Answer: A. Hyperthyroidism symptoms. Rationale: levothyroxine is a synthetic thyroid hormone, and overdosage can lead to hyperthyroidism symptoms, like tachycardia, nervousness, and weight loss. Hypotension, B, hyperglycemia, C, and weight gain, D, are not common side effects of levothyroxine. 102. A patient is prescribed furosemide for edema. Which of the following side effects should the nurse monitor for? A. Hypokalemia. B. Hyperglycemia. C. Bradycardia. D. Weight gain. Answer: A. Hypokalemia. Rationale: furosemide, a loop diuretic, can cause hypokalemia, as it increases potassium excretion. Hyperglycemia, B, bradycardia, C, and weight gain, D, are not common side effects of furosemide. 103. A nurse is caring for a patient receiving iron supplements. Which of the following side effects should the nurse monitor for? A. Constipation. B. Diarrhea. C. Nausea and vomiting. D. Weight loss. Answer: A. Constipation. Rationale. Iron supplements commonly cause constipation. A. Diarrhea. B. Nausea and vomiting. C. And weight loss. D. Are less common side effects of iron therapy. 104. A nurse is administering lisinopril to a patient with hypertension. Which of the following side effects should the nurse monitor for? A. Persistent dry cough. B. Hyperkalemia. C. Weight gain. D. Constipation. Answer. A. Persistent dry cough. Rationale. Lisinopril, an ACE inhibitor, is known to cause a persistent dry cough. A. In some patients. Hyperkalemia. B. Weight gain. C. And constipation. D. Are not typical side effects of lisinopril. 105. A patient is prescribed azithromycin for an infection. Which of the following side effects should the nurse monitor for? A. Diarrhea. B. Weight loss. C. Hypertension. D. Constipation. Answer. A. Diarrhea. Rationale. Azithromycin, an antibiotic, can cause diarrhea. A. As a side effect. Weight loss. B. Hypertension. C. And constipation. D. Are not common side effects of azithromycin. 106. A nurse is caring for a patient receiving metformin for type 2 diabetes. Which of the following side effects should the nurse monitor for? A. Lactic acidosis. B. Hypoglycemia. C. Weight gain. D. Hyperglycemia. Answer. A. Lactic acidosis. Rationale. Metformin can cause lactic acidosis. A rare but serious side effect. Hypoglycemia. B. Is not a common side effect of metformin unless used with other hypoglycemic agents. Weight gain. C. And hyperglycemia. D. Are not typical side effects of metformin. 107. A patient is receiving sildenafil for erectile dysfunction. Which of the following side effects should the nurse monitor for? A. Priapism. B. Hypoglycemia. C. Weight gain. D. Hyperkalemia. Answer. A. Priapism. Rationale. Sildenafil can cause priapism. A prolonged and painful erection, which requires medical intervention. Hypoglycemia. B. Weight gain. C. And hyperkalemia. D. Are not common side effects of sildenafil. 108. A nurse is administering nitroglycerin to a patient with chest pain. Which of the following side effects should the nurse monitor for? A. Headache. B. Diarrhea. C. Tachycardia. D. Weight gain. Answer. A. Headache. Rationale. Nitroglycerin is a vasodilator, and one common side effect is a headache. A. Due to the dilation of blood vessels. Diarrhea. B. Tachycardia. C. And weight gain. D. Are not common side effects of nitroglycerin. 109. A nurse is caring for a patient who is prescribed ibuprofen for pain. Which of the following side effects should the nurse monitor for? A. Gastric ulcer. B. Constipation. C. Weight loss. D. Hyperkalemia. Answer. A. Gastric ulcer. Rationale. Ibuprofen, an NSAID, can cause gastric ulcers. A. Due to its irritation of the stomach lining. Constipation. B. Weight loss. C. And hyperkalemia. D. Are not common side effects of ibuprofen. 110. A patient is prescribed fluoxetine for depression. Which of the following side effects should the nurse monitor for? A. Serotonin syndrome. B. Hypoglycemia. C. Tachycardia. D. Weight loss. Answer. A. Serotonin syndrome. Rationale. Fluoxetine, a selective serotonin reuptake inhibitor, SSRI, can cause serotonin syndrome. A. In rare cases, characterized by agitation, confusion, and fever. Hypoglycemia. B. Tachycardia. C. And weight loss. D. Are not common side effects of fluoxetine. 111. A nurse is administering hydrochlorothiazide to a patient with hypertension. Which of the following side effects should the nurse monitor for? A. Hypokalemia. B. Hyperglycemia. C. Weight gain. D. Tachycardia. Answer. A. Hypokalemia. Rationale. Hydrochlorothiazide, a thiazide diuretic, can cause hypokalemia. A. As it increases potassium excretion. Hyperglycemia. B. Weight gain. C. And tachycardia. D. are not common side effects of hydrochlorothiazide. 112. A patient is prescribed prednisone for an inflammatory condition. Which of the following side effects should the nurse monitor for? A. Hyperglycemia. B. Hypotension. C. Weight loss. D. Constipation. Answer: A. Hyperglycemia. Rationale: prednisone, a corticosteroid, can cause hyperglycemia, A. as a side effect. Hypotension, B. Weight loss, C. and constipation, D. are not typical side effects of prednisone. 113. A nurse is caring for a patient receiving doxycycline for an infection. Which of the following should the nurse instruct the patient to avoid? A. Sun exposure. B. Dairy products. C. Alcohol. D. High-sodium foods. Answer: A. Sun exposure. Rationale: doxycycline can increase sensitivity to sunlight, A. leading to an increased risk of sunburn. Dairy products, B. do not interfere with doxycycline absorption, and alcohol, C. and high-sodium foods, D. are not contraindicated with doxycycline. 114. A patient is receiving esomeprazole for gastroesophageal reflux disease. Which of the following side effects should the nurse monitor for? A. Diarrhea. B. Constipation. C. Tachycardia. D. Hypotension. Answer: A. Diarrhea. Rationale: esomeprazole, a proton pump inhibitor, PPI, can cause diarrhea, A. as a side effect. Constipation, B. Tachycardia, C. and hypotension, D. are not common side effects of esomeprazole. 115. A nurse is administering propranolol to a patient with hypertension. Which of the following side effects should the nurse monitor for? A. Bradycardia. B. Hyperglycemia. C. Weight gain. D. Increased appetite. Answer: A. Bradycardia. Rationale: propranolol, a beta blocker, can cause bradycardia, A. as a side effect due to its effect on the heart's rhythm. Hyperglycemia, B. Weight gain, C. and increased appetite, D. are not common side effects of propranolol. 116. A nurse is educating a patient who is starting on amitriptyline for depression. Which of the following side effects should the nurse emphasize? A. Dry mouth. B. Weight loss. C. Diarrhea. D. Dizziness. Answer: A. Dry mouth. Rationale: amitriptyline, a tricyclic antidepressant, often causes dry mouth, A. as a side effect. Weight loss, B. Diarrhea, C. and dizziness, D. are not common side effects of amitriptyline. 117. A patient is prescribed ciprofloxacin for a bacterial infection. Which of the following side effects should the nurse monitor for? A. Tendon rupture. B. Hypoglycemia. C. Hypotension. D. Hyperkalemia. Answer: A. Tendon rupture. Rationale: ciprofloxacin, a fluoroquinolone, can increase the risk of tendon rupture, A. especially in elderly patients. Hypoglycemia, B. Hypotension, C. and hyperkalemia, D. are not common side effects of ciprofloxacin. 118. A nurse is caring for a patient receiving clopidogrel. Which of the following side effects should the nurse monitor for? A. Bleeding. B. Constipation. C. Weight loss. D. Tachycardia. Answer: A. Bleeding. Rationale: clopidogrel is an antiplatelet medication, and its most significant side effect is bleeding, A. Constipation, B. Weight loss, C. and tachycardia, D. are not typical side effects of clopidogrel. 119. A patient is receiving atorvastatin for hyperlipidemia. Which of the following side effects should the nurse monitor for? A. Muscle pain. B. Constipation. C. Hyperkalemia. D. Weight gain. Answer: A. Muscle pain. Rationale: atorvastatin, a statin, can cause muscle pain, A. which is a sign of possible myopathy. Constipation, B. Hyperkalemia, C. and weight gain, D. are not common side effects of atorvastatin. 120. A nurse is educating a patient prescribed lithium for bipolar disorder. Which of the following should the nurse emphasize regarding side effects? A. Risk of dehydration. B. Increased appetite. C. Diarrhea. D. Low blood pressure. Answer: A. Risk of dehydration. Rationale: lithium can cause dehydration, A, which increases the risk of toxicity. Increased appetite, B, diarrhea, C, and low blood pressure, D, are not commonly associated with lithium. 121. A nurse is caring for a patient receiving ibuprofen for pain management. Which of the following side effects should the nurse monitor for? A. Gastric ulcer. B. Drowsiness. C. Weight loss. D. Hyperkalemia. Answer: A. Gastric ulcer. Rationale: ibuprofen, a nonsteroidal anti-inflammatory drug, NSAID, can cause gastric ulcers, A, as a common side effect. Drowsiness, B, weight loss, C, and hyperkalemia, D, are not typical side effects of ibuprofen. 122. A nurse is caring for a patient receiving warfarin. Which of the following side effects should the nurse monitor for? A. Bleeding. B. Hyperkalemia. C. Tachycardia. D. Weight gain. Answer: A. Bleeding. Rationale: warfarin, an anticoagulant, significantly increases the risk of bleeding, A. Hyperkalemia, B. Tachycardia, C. and weight gain, D. are not common side effects of warfarin. 123. A nurse is caring for a patient on levothyroxine for hypothyroidism. Which of the following side effects should the nurse monitor for? A. Hyperthyroidism symptoms. B. Weight gain. C. Constipation. D. Hyperglycemia. Answer: A. Hyperthyroidism symptoms. Rationale: levothyroxine is a synthetic thyroid hormone, and overdose can cause hyperthyroidism symptoms, A, such as tachycardia, weight loss, and nervousness. Weight gain, B, constipation, C, and hyperglycemia, D, are not typically associated with levothyroxine. 124. A nurse is educating a patient who is taking a calcium channel blocker. Which of the following side effects should the nurse monitor for? A. Peripheral edema. B. Hypoglycemia. C. Weight loss. D. Hyperkalemia. Answer: A. Peripheral edema. Rationale: calcium channel blockers can cause peripheral edema, A, as a common side effect. Hypoglycemia, B, weight loss, C, and hyperkalemia, D, are not typical side effects of calcium channel blockers. 125. A patient is prescribed azithromycin for an infection. Which of the following side effects should the nurse monitor for? A. Diarrhea. B. Tachycardia. C. Weight gain. D. Hypoglycemia. Answer: A. Diarrhea. Rationale: azithromycin can cause diarrhea, A, as a common side effect. Tachycardia, B, weight gain, C, and hypoglycemia, D, are not typical side effects of azithromycin. 126. A nurse is educating a patient on the side effects of prednisone therapy. Which of the following should the nurse emphasize? A. Risk of infection. B. Hypotension. C. Weight loss. D. Constipation. Answer: A. Risk of infection. Rationale: prednisone, a corticosteroid, suppresses the immune system, increasing the risk of infection, A. Hypotension, B, weight loss, C, and constipation, D, are not common side effects of prednisone. 127. A nurse is administering aspirin to a patient. Which of the following side effects should the nurse monitor for? A. Tinnitus. B. Bradycardia. C. Weight gain. D. Hypoglycemia. Answer: A. Tinnitus. Rationale: aspirin can cause tinnitus, A, or ringing in the ears, as a side effect, especially at high doses. Bradycardia, B, weight gain, C, and hypoglycemia, D, are not typical side effects of aspirin. 128. A nurse is caring for a patient receiving metformin for type 2 diabetes. Which of the following side effects should the nurse monitor for? A. Lactic acidosis. B. Hypoglycemia. C. Constipation. D. Weight gain. Answer: A. Lactic acidosis. Rationale: metformin can cause lactic acidosis, A, a rare but serious side effect, especially in patients with kidney dysfunction. Hypoglycemia, B, is not common with metformin unless combined with other hypoglycemic agents. Constipation, C, and weight gain, D, are less common side effects. 129. A patient is prescribed naloxone following opioid overdose. Which of the following side effects should the nurse monitor for? A. Withdrawal symptoms. B. Bradycardia. C. Hypertension. D. Weight loss. Answer. A. Withdrawal symptoms. Rationale. Naloxone reverses opioid effects and withdrawal symptoms, A, may occur in opioid-dependent individuals. Bradycardia, B, hypertension, C, and weight loss, D, are not common side effects of naloxone. 130. A nurse is educating a patient taking hydrochlorothiazide for hypertension. Which of the following side effects should the nurse monitor for? A. Hypokalemia. B. Hyperglycemia. C. Weight gain. D. Tachycardia. Answer. A. Hypokalemia. Rationale. Hydrochlorothiazide, a thiazide diuretic, can cause hypokalemia, A, as it increases potassium excretion. Hyperglycemia, B, weight gain, C, and tachycardia, D, are not common side effects of hydrochlorothiazide. 131. A patient is prescribed furosemide for edema. Which of the following side effects should the nurse monitor for? A. Hypokalemia. B. Diarrhea. C. Hypercalcemia. D. Bradycardia. Answer. A. Hypokalemia. Rationale. Furosemide, a loop diuretic, can cause hypokalemia, A, due to increased potassium excretion. Diarrhea, B, hypercalcemia, C, and bradycardia, D, are not common side effects of furosemide. 132. A nurse is educating a patient starting on levodopa for Parkinson's disease. Which of the following side effects should the nurse monitor for? A. Dyskinesia. B. Weight gain. C. Diarrhea. D. Tachycardia. Answer. A. Dyskinesia. Rationale. Levodopa, used in Parkinson's disease, can cause dyskinesia, A, or involuntary movements as a side effect. Weight gain, B, diarrhea, C, and tachycardia, D, are not typical side effects of levodopa. 133. A nurse is administering digoxin to a patient with heart failure. Which of the following side effects should the nurse monitor for? A. Digoxin toxicity. B. Hypoglycemia. C. Weight loss. D. Tachycardia. Answer. A. Digoxin toxicity. Rationale. Digoxin toxicity, A, can cause nausea, vomiting, and visual disturbances. Hypoglycemia, B, weight loss, C, and tachycardia, D, are not common side effects of digoxin. 134. A patient is receiving tramadol for pain. Which of the following side effects should the nurse monitor for? A. Seizures. B. Tachycardia. C. Weight gain. D. Hypotension. Answer. A. Seizures. Rationale. Tramadol can lower the seizure threshold, A, increasing the risk of seizures. Tachycardia, B, weight gain, C, and hypotension, D, are not common side effects of tramadol. 135. A nurse is administering amlodipine to a patient for hypertension. Which of the following side effects should the nurse monitor for? A. Peripheral edema. B. Constipation. C. Weight loss. D. Hyperkalemia. Answer. A. Peripheral edema. Rationale. Amlodipine, a calcium channel blocker, commonly causes peripheral edema, A, as a side effect. Constipation, B, weight loss, C, and hyperkalemia, D, are not typical side effects of amlodipine. 136. A nurse is caring for a patient receiving baclofen for muscle spasms. Which of the following side effects should the nurse monitor for? A. Drowsiness. B. Tachycardia. C. Weight gain. D. Hyperkalemia. Answer. A. Drowsiness. Rationale. Baclofen, a muscle relaxant, can cause drowsiness, A, as a common side effect. Tachycardia, B, weight gain, C, and hyperkalemia, D, are not common side effects of baclofen. 137. A nurse is administering enalapril to a patient with hypertension. Which of the following side effects should the nurse monitor for? A. Dry cough. B. Diarrhea. C. Weight gain. D. Tachycardia. Answer: A. Avoid foods high in protein. Rationale: high-protein foods can interfere with the absorption of levodopa. A. Sunlight exposure. B. Fluid intake. C. And sodium intake. D. Do not typically interfere with levodopa absorption. 138. A nurse is educating a patient starting on levodopa for Parkinson's disease. Which of the following should the nurse include in the teaching? A. Avoid foods high in protein. B. Avoid sunlight exposure. C. Increase fluid intake. D. Limit sodium intake. Answer: A. Liver toxicity. Rationale: antiretroviral drugs, especially protease inhibitors, can cause liver toxicity. A. As a side effect. Bradycardia. B. Hyperkalemia. C. And weight loss. D. Are not common side effects of antiretroviral therapy. 139. A nurse is caring for a patient on antiretroviral therapy for HIV. Which of the following side effects should the nurse monitor for? A. Liver toxicity. B. Bradycardia. C. Hyperkalemia. D. Weight loss. Answer: A. Bradycardia. Rationale: metoprolol, a beta blocker, can cause bradycardia. A. As a side effect due to its effect on heart rate. Weight gain. B. Hyperglycemia. C. And diarrhea. D. Are not typical side effects of metoprolol. 140. A nurse is administering metoprolol to a patient with hypertension. Which of the following side effects should the nurse monitor for? A. Bradycardia. B. Weight gain. C. Hyperglycemia. D. Diarrhea. Answer: A. Hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic and can lead to hyperkalemia. A. Due to its retention of potassium. Hypoglycemia. B. Tachycardia. C. And weight loss. D. Are not typical side effects of spironolactone. 141. A nurse is educating a patient on the side effects of taking spironolactone for hypertension. Which of the following side effects should the nurse monitor for? A. Hyperkalemia. B. Hypoglycemia. C. Tachycardia. D. Weight loss. Answer: A. Hyperkalemia. Rationale: spironolactone is a potassium-sparing diuretic and can lead to hyperkalemia. A. Due to its retention of potassium. Hypoglycemia. B. Tachycardia. C. And weight loss. D. Are not typical side effects of spironolactone. 142. A nurse is administering ondansetron to a patient undergoing chemotherapy. Which of the following side effects should the nurse monitor for? A. Headache. B. Weight gain. C. Diarrhea. D. Drowsiness. Answer: A. Headache. Rationale: ondansetron, an antiemetic, commonly causes headaches. A. As a side effect. Weight gain. B. Diarrhea. C. And drowsiness. D. Are not typical side effects of ondansetron. 143. A patient is prescribed gabapentin for neuropathic pain. Which of the following side effects should the nurse monitor for? A. Dizziness. B. Weight loss. C. Tachycardia. D. Hyperkalemia. Answer: A. Dizziness. Rationale: gabapentin commonly causes dizziness. A. As a side effect, especially when starting the medication. Weight loss. B. Tachycardia. C. And hyperkalemia. D. Are not typical side effects of gabapentin. 144. A nurse is caring for a patient receiving clindamycin for an infection. Which of the following side effects should the nurse monitor for? A. Diarrhea. B. Hypertension. C. Constipation. D. Bradycardia. Answer: A. Diarrhea. Rationale: clindamycin is an antibiotic that can cause diarrhea. A. Including Clostridium difficile infection, which can be severe. Hypertension. B. Constipation. C. And bradycardia. D. Are not common side effects of clindamycin. 145. A nurse is educating a patient taking zolpidem for insomnia. Which of the following side effects should the nurse emphasize? A. Drowsiness. B. Tachycardia. C. Weight gain. D. Hyperkalemia. Answer: A. Drowsiness. Rationale: zolpidem is a sedative hypnotic medication that commonly causes drowsiness. A. As a side effect. tachycardia, B. Weight gain, C. And hyperkalemia, D. are not typical side effects of zolpidem. 146. A patient is prescribed albuterol for asthma. Which of the following side effects should the nurse monitor for? A. Tremors. B. Bradycardia. C. Hypoglycemia. D. Constipation. Answer: A. Tremors. Rationale: albuterol, a beta agonist, can cause tremors, A, as a common side effect due to its stimulant effect on the nervous system. Bradycardia, B. Hypoglycemia, C. And constipation, D. are not typical side effects of albuterol. 147. A nurse is caring for a patient who is receiving prednisone for an autoimmune condition. Which of the following side effects should the nurse monitor for? A. Hyperglycemia. B. Bradycardia. C. Weight loss. D. Hypertension. Answer: A. Hyperglycemia. Rationale: prednisone, a corticosteroid, can cause hyperglycemia, A. as a side effect. Bradycardia, B. Weight loss, C. And hypertension, D. are not typical side effects of prednisone. 148. A patient is prescribed tramadol for moderate pain relief. Which of the following side effects should the nurse monitor for? A. Seizures. B. Weight gain. C. Diarrhea. D. Tachycardia. Answer: A. Seizures. Rationale: tramadol can lower the seizure threshold, A, leading to a risk for seizures, especially at high doses or when combined with other medications. Weight gain, B. Diarrhea, C. And tachycardia, D. are not common side effects of tramadol. 149. A nurse is administering vancomycin to a patient for a severe infection. Which of the following side effects should the nurse monitor for? A. Ototoxicity. B. Diarrhea. C. Weight loss. D. Bradycardia. Answer: A. Ototoxicity. Rationale: vancomycin can cause ototoxicity, A, which may lead to hearing loss, especially with high doses or prolonged use. Diarrhea, B. Weight loss, C. And bradycardia, D. are not common side effects of vancomycin. 150. A nurse is educating a patient starting on atenolol for hypertension. Which of the following side effects should the nurse monitor for? A. Bradycardia. B. Weight gain. C. Hyperkalemia. D. Tachycardia. Answer: A. Bradycardia. Rationale: atenolol, a beta blocker, can cause bradycardia, A, due to its effect on heart rate. Weight gain, B. Hyperkalemia, C. And tachycardia, D. are not typical side effects of atenolol.